Hi, everyone. This is Michael Coombs here, presenting my final project. And let's give this screen sharing a whirl. Okay. Hopefully this will work okay. Let's see if I need to move this. Okay, so the program that I have been working on is introducing a nutrition education curriculum for kindergartners. And this is presented by myself, Michael Coombs, in partial fulfillment of the requirements for WE 623 through Rocky Mountain University. So the program rationale, the percentage of children being diagnosed with obesity has more than tripled in the last 40 years, and the greatest increase in prevalence was recorded in children between the first and third grades. Research suggests health initiatives would most effectively influence positive eating patterns and health behaviors if designed and delivered to a younger audience. Childhood obesity is so concerning because it is correlated with chronic health conditions and diseases, including type 2 diabetes, asthma, musculoskeletal problems, and risk factors for heart disease and cancers. And children diagnosed as obese are more likely to follow the trajectory and be adults diagnosed with obesity and accompanying health concerns. Obesity affects 92% of children, and treatment for chronic illness related to obesity costs the US healthcare system $147 billion per year. Poor eating habits and health behaviors affecting weight are evidenced by 12.4% of American children entering kindergarten already obese and 14.9% considered overweight. Creating and implementing a nutrition education curriculum at the kindergarten level would shape dietary behaviors before obesity became an official diagnosis. Dietary behavior initiatives with young children as the priority population can be difficult because children simply eat what they have access to. Within the last few years, it has become even more apparent that not all Americans have equal access or opportunity to be healthy or make healthy choices, despite great motivation or work to overcome barriers. Disparities in health are now primarily due to social differences. Americans' health varies by geographic location, income, education, race, and ethnicity. Obesity, as most adverse health-related conditions, is disproportionately shouldered by the lower class and racial and ethnic minorities. This means a child's food choices and dietary behaviors are largely out of their hands, as their food environment, socioeconomic condition, and other social barriers are conditions a child is in, not necessarily conditions a child can influence and change. Currently, the majority of health and nutrition initiatives and campaigns target youth starting around the age of 8. However, research reports eating patterns, social cues, and health behaviors are established by the age of 5. US elementary school curriculums currently include a total of only 4.6 hours of nutrition education. And schools nationwide that require nutrition curriculums decreased from 84.6% to 74.1% between 2000 and 2014. Schools are also largely becoming the primary source of offering stable meals for children in lower socioeconomic areas. Given the importance of food choices and dietary behaviors in preventing obesity and chronic disease, school curriculums would ideally be the place to integrate nutrition education. Beginning a nutrition education curriculum in kindergarten and providing resources to families would empower children to make healthy food choices, favorably affecting their long-term health outcomes. For my project, I also decided to focus the intervention on the school district where I live, Nebo School District in Utah County, Utah. In 2019, the Utah State Board of Education updated its core health education standards to include 6 areas of focus that promote the social, physical, mental, and emotional health of Utah students. 4 of the 6 areas of focus are introduced in kindergarten: health foundations and protective factors of healthy self, mental and emotional health, nutrition, and human development. These concepts, however, are mapped within the kindergarten curriculum in only 1 out of 40 weeks for the school year, and sample activities to include nutrition material in their classrooms are found only if the teacher actively searches for the material on the Utah Education Network website. Previous studies demonstrate kindergarten-based, family-involved interventions effectively increase fruit consumption and reduce calorie-dense food choices, improve healthy snack choices, and family-related determinants of health. However, kindergarten teachers also reported barriers such as perceived lack of nutrition knowledge, limited classroom time beyond the mandated state standards, and cost of using commercially available nutrition education programs. In my research on this topic, I found an effective evidence-based nutrition resource for kindergarten classrooms. The Boss's Healthy Buddies curriculum directly addresses the two barriers of lack of time and cost by offering an evidence-based program complete with 35 prepared lessons, offered through completely free online access. Each 15 to 20 minute evidence-based lesson plan consists of one nutrition concept that teachers will include in their curriculum map just once a week, and also provides at-home activities to engage the students' families. It is recommended a needs assessment be performed in the form of a focus group interview with the kindergarten teachers and elementary school principals of Nebo School District, Utah County. A focus group of this nature will enable the researchers to determine kindergarten teachers' current attitudes, knowledge, and practices regarding nutrition education, discuss time, cost, or other barriers, and review the Boss's Healthy Buddies curriculum for open discussion and feedback. The socio-ecological model used in behavior modification emphasizes the interdependence between the individual's behavior and the social contexts that make up their environment. The social contexts that directly and indirectly influence behavior include families and friends, social networks, workplaces, schools, religious organizations, and more. A successful intervention using the ecological framework includes a multi-level approach that integrates multiple social contexts. The ecological perspective is an appropriate theoretical framework to implement with a kindergarten nutrition education program for a number of reasons. First, the intrapersonal level construct would influence the kindergarten children's knowledge, attitudes, and beliefs regarding nutrition. Next, the interpersonal level would involve the children's family and friends, both of whom influence social identity and lend support. And finally, the community and societal levels would involve institutional factors such as the school district changing school lunches to whole food options, or public policy factors such as the school district changing curriculum. Interventions targeting a young population must include multi-level approaches, because even if you change a child's intrapersonal knowledge and attitudes regarding healthy behaviors and food choices, children are still dependent on and receive behavioral cues from varying interpersonal and community level constructs. The mission of the program is to reduce childhood obesity through education, family and community-based activities, and influence policy structures to enable equal access to healthy food options. Program goals include provide instruction that will teach kindergartners in Nebo School District healthy behaviors, define the health benefits of whole food choices, and emphasize the importance of consistent fruits and vegetables in their diet. Create educational workshops targeting the parents or guardians to examine their child's behavior and diet, physical activity, media use, and sleep habits. Collaborate with policymakers to change school nutrition options to whole food options offered at breakfast or lunch. Create networking opportunities with local universities and utilize public health students for teaching internships. Since this program uses the socio-ecological model that includes multi-level constructs, the program objectives mainly focus on the intrapersonal or individual level of the student learning outcomes, following the learning objectives as provided by the Boss's Healthy Buddies curriculum. Ideally, this program will be implemented district-wide as a new curriculum for kindergarten classes. It is therefore recommended a pilot program first be conducted using an experimental design. The pilot program will be conducted with 2 randomly selected elementary school kindergarten classes within the Nebo School District. The intervention elementary school will receive 8 weeks of Boss's Healthy Buddies nutrition education material taught by the program developer, weekly handouts, and 2 education sessions with the families or guardians. The control elementary school will receive the current Nebo School District nutrition education material during the 8-week duration. Kindergarten classes will receive nutrition pre and post assessments at the start and finish of the 8-week session, which will function in part to measure the knowledge, attitudes, and beliefs around healthy food habits. Conducting a pilot program will allow the program developers and stakeholders to determine the efficacy of the educational program, make formative evaluation changes, and take the most impactful approach for district-wide implementation. Stakeholders for this program include Nebo School District policymakers, school administrators, and elementary school principals. This group will meet with the program developer prior to implementing the pilot program to receive an overview of the program mission, goals, and objectives, a general description of the nutrition education program, and the experimental design. This meeting will be collaborative in nature, allowing the stakeholders to advocate for changes, discuss outcomes, and make changes to the proposed curriculum and education materials. In addition to presenting the nutrition education program mission, goals, and objectives, the other elements to be described are literature review to demonstrate current literature on childhood obesity and the success in other kindergarten nutrition education programs, needs assessment specific to Nebo School District, a logic model with Gantt chart to demonstrate the timeline of the pilot program, evaluation of the pilot program, and transition to full curriculum district-wide implementation. A full BOSS's Healthy Buddies curriculum will also be presented during the stakeholder meeting so they can see the progression of lessons, educational materials, and pre and post assessments to be used as process and impact evaluations. Following the 8-week pilot program, the stakeholders and program developer will meet again to discuss findings. The utility, feasibility, propriety, and accuracy standards will be discussed at this time. Topics to be discussed will include how to disseminate the information gathered from the pilot program, the most effective method to implement the curriculum district-wide, budgetary and material requirements, the possibility of utilizing public health undergraduate students as interns, means of gathering data, analyzing data, and impact and outcome evaluations. This meeting will function as a formative evaluation as it will review the efficacy of the pilot program and make necessary changes prior to district-wide implementation. A report will be composed following both the pilot program and the first year after district-wide implementation. Both of these reports will focus on results from the program, expected efficacy of the educational material, recommendations for further research and implementation in other school districts. Limitations from the pilot program and district-wide implementation will also be discussed. This is a topic that I am passionate about, and I hope that nutrition starting at younger ages will be included in education curriculums to help mold future healthy behaviors. These are the references throughout my presentation, and I hope you enjoyed this. Thank you.